to our Understanding the Impact of the Menopause at Work virtual boardroom that's being facilitated by HR Recruit and Ali Grady. My name's Jo Thompson and I'm a consultant for HR Recruit. I'm joined today by Ali, who will introduce herself shortly. Ali is going to explore the business case for supporting menstruation and menopause at work and the steps you can take to foster open conversations to create a supportive environment where individuals and businesses can thrive. If you do have any burning questions during the session, then please put them into the chat box facility and we'll try and cover them as we go along. I'm now going to hand you over to Ali, who will introduce herself and start the session. Thank you.
Thanks, Jay. Thanks very much, and hello to everyone, and welcome. Just a sort of short background about me. My name's Ali Grady. I have a company called the Thrive Team. We are headhunters, but also coaches and trainers. And a lot of the training that we provide is around wellbeing in the workplace, mental health first aid, and more recently, we've started to explore around menopause at work and even more recently than that, menstruation as well. So my background is in HR. I've sort of held HR positions in large organisations such as Boots the Chemist, the NHS and the BBC. And I suppose I've developed a real interest in menopause in the workplace, primarily due to my own experience and the lack of conversations that were being had. I've also lived with endometriosis for all of my adult life, which resulted in me having a hysterectomy at 42, which was 14 years ago now. So I'm sure I'll share a little bit more of my story as I go through, but that's probably enough about me before we get going. So as Joe said, we're here to talk about really the sort of impact of menstruation and menopause in the workplace. So we've only got 45 minutes. I'm sure you'll appreciate two massive topics and not much time to do it justice, but I'm going to do my best. And I think it's really also important to say that I don't have any medical training as well. So a lot of what I'll be talking about will be that sort of top line information, but hopefully enough for you to gather your thoughts around these two really important topics. So today it's about raising awareness of some of the common conditions that affect menstruation. It's also about raising awareness around menopause, the stages, some of those common symptoms and treatments. But really we'll be exploring the impact of menstruation, menstrual health and menopause at work, and really thinking about that business case that I think is really quite evident once we start to get into it. And for you, it's also about considerations that you might take into account for creating menstruation and menopause friendly workplaces. And I'm going to signpost you to some resources as well, so that I'm sure you'll have lots to think about after the session, and some more ways to explore. Just a point, I'm probably going to refer to women throughout this session, but when I talk about women, I'm actually referring to anyone who has periods or who may be going through a menopause transition. Okay, so next slide then. Just to sort of really, we're going to add a bit more sort of information to this slide as we go through, but just to sort of be clear what we're talking about here in terms of pre-menopause, we're talking about that stage in life when a woman is having her menstrual cycle. So these are the prime sort of childbearing years, and there are no signs of menopause. On average, people who menstruate have around 480 periods in their lifetime, and a typical cycle could last between anything from 23 to 38 days. When we're talking about perimenopause, that's that early stage where perhaps hormones are starting to fluctuate. Timescales or the age when that starts varies, but often mid to late 40s. And menopause, we'll get into a little bit more about that, but that's actually the date, the day in a woman's life when her periods stop, and then we're talking about post-menopause. So a little bit more information about each of those phases. So when we're talking about pre-menopause stage, as I say, this is the time when women are having their sort of menstrual cycle, and that can last for over 35 years, depending on when you start your period. So we're in a long time in this phase, and for many women, that it might not be problematic, but as we'll see from some of the information I'm about to share, there are many women who experience some significant difficulties and challenges with their menstruation cycle. So I'm going to share some of those perhaps common gynecological conditions that people may experience. So the first is dysmenorrhea, which is painful periods and significant enough to interfere with somebody's lifestyle. So that could start as early as 12 to 14, and the discomfort typically lasts for a few hours, may even last a full day. So I'm guessing many people might recognize that as painful period. Endometriosis, I mentioned that I have endometriosis. You can see 10% of women are affected, and it's a condition where tissue similar to the lining of the womb grows outside and causes pain and other symptoms such as fatigue, digestive problems, bladder, bowel issues, bloating, perhaps difficulty concentrating, difficulty sleeping, painful sex. I could go on, massive, massive list. The average um, time for diagnosis for endometriosis is between 8 and 10 years in the UK, depending on when you live. So in Wales, it's actually 12 years. Endometriosis can only be diagnosed through a surgical procedure called a laparoscopy. It can also cause infertility. I mentioned that I lived with endometriosis for all of my sort of adult life, and I've had a number of hysterectomy, a number of laparoscopies, and I remember after my second laparoscopy, I was told that if I didn't conceive within the first 3 months, following the operation, then I was unlikely to conceive. I was 25. I just wanted to be free of pain. I didn't, thoughts of having children were sort of far distant from me at that point. Adenomyosis, about 20 to 35% of women are affected. And this is where the lining of the womb starts growing in the muscle wall. And that can include painful periods, heavy bleeding, bloating, pain during sex, more commonly diagnosed in women over 30, but it can affect anyone. Uterine fibroids, again, quite common. Benign tumours, again, symptoms can cause infertility, unpleasant sexual encounters, heavy or regular bleeding, dysmenorrhea, can also increase pregnancy loss or miscarriage, and premature childbirth. So again, a huge range of symptoms there. Polycystic ovary syndrome, again, quite common, 1 in 10 women affected. That's a hormonal disorder with a range of symptoms, including irregular periods, acne, weight gain. These symptoms can also impact self-confidence and self-esteem, and lead to decreased productivity and increased presenteeism or sort of absenteeism at work. Premenstrual syndrome, again, very common, 30% of women affected. These might, again, many women might recognize this. Mood swings, feeling upset, anxious, irritable, tiredness, trouble sleeping, bloating, headaches, spotty skin, greasy hair, changes in appetite, changes in sex drive, etc. And also premenstrual dysphoric disorder. Again, 5 to 8% of women experiencing that. So more extreme symptoms of premenstrual symptom can include low mood, depression, and even thoughts of suicide. So some pretty horrible sort of symptoms that we can see from the percentages and the number of women affected, pretty common. So let's move on to think about the stages of menopause. And And as I mentioned in the previous slide, they've got the perimenopause, which is that first stage. It's when the hormones are starting to fluctuate, reproductive hormones are beginning to change, and women's menstrual cycle becomes irregular. You can have symptoms of the menopause, but your periods haven't stopped. And perimenopause ends when you reach the menopause and you've not had a period for 12 months. So the menopause average age for onset is 51, and this is when a woman's body stops producing hormones that cause ovulation and menstrual periods. So it usually affects women between the ages of 45 and 55, but it can happen earlier. Women of colour tend to go through menopause in their late 40s, with factors such as stress resulting from racism contributing to an earlier transition. So menopause is defined as 12 months after your last period. So you won't necessarily know it's your last period until that 12-month period has elapsed. So women can go through this sort of cycle of having many, many months of not having a period, say, 11 months, and then a period returns. And so at that stage, they're still in the perimenopause phase. So as I say, just to clarify, menopause is actually one day in time, which is 12 months after your last period. So it can affect anyone who has periods and can happen naturally or for other sort of medical reasons. So there might be surgery to remove ovaries or hysterectomy, and cancer treatments like chemotherapy can also force people into the menopause. So there are a small percentage of women, 1 to 3% of women, where premature menopause will occur, and that's considered to be before the age of 40. So that's called premature ovarian failure. And then the final stage is that post-menopause stage where you've periods have stopped and you're no longer ovulating and you're no longer able to conceive. And again, we can spend a considerable amount of years in this post-menopause stage, so 30 to 50 years. So important to remember, everyone's experience of menstruation and menopause is unique to them. And certainly in terms of the menopause, there's no set age or time limits for symptoms. And it's really important to recognize that everybody's experience will be different. About half of the workforce in the UK are over 16 and female. And so that's a lot of people to be struggling with either menstrual health or menopause symptoms in the workplace. So let's think about who this affects. Well, as we've already sort of said, women affected directly, but as well as women, we also have the transgender community, people whose gender is different from the sex that they were assigned at birth. We also have intersex community, people who have differences in their sex development and who don't conform to typical definitions of male or female bodies. And we've also got people whose gender is neither male nor female and who identify as non-binary. And then indirectly, well, that's probably everybody else. It's family, friends, partners, colleagues at work, the organization as a whole. So it's really important that we view menstrual health and menopause as an organization-wide issue rather than a gender-specific issue. Okay. So let's have a think about some of those common menopause symptoms. I'm sure we would have a much longer list than this. I think the general checklists include about 30 symptoms. And I don't know about you, but my knowledge of menopause before I went through it myself was pretty limited. It wasn't talked about when I was a young woman. It probably wasn't talked about when I was in my 30s either. And so I was pretty ignorant. I thought, I was familiar with sort of hot flushes, but anything else I wasn't really that sort of familiar with. And I guess for me, the sort of real significant impact that it had that nobody prepared me for was the effect on my mental health, my psychological well-being, the increased anxiety, and often depression, actually. And being honest, there were times when I had thoughts of suicide as well. So just have a look at that sort of list on the screen and think about how might they impact in the workplace. We've just take a simple thing like somebody experiencing night sweats and having difficulty sleeping, then they're not likely to be firing on all cylinders the next day. That's bound to affect productivity, concentration, depending on the industry that you work in. That's going to have an impact on health and safety, might have an impact on customer relations. So, there's a real knock-on effect. Some of the less common symptoms that aren't listed, and I can probably say that I've experienced a number of these: metallic taste in your mouth, greater sensitivities to taste, itchy ears, increased in allergies, restless legs, dizziness, driving anxiety as well. Lots of, and there'll be lots of other stories. So, menopause can cause symptoms that do cause people to, or can cause people to lose confidence in their abilities, and that can lead to stress, anxiety, and depression. Only 1 in 4 women were offered or there's some research by the Fawcett Society, and it shows that almost half of women haven't approached their GPs, and 3 in 10 have seen delays in diagnosis, and only 4 in 10 women were offered HRT in a timely fashion. Now, of course, HRT isn't for everyone. That should be a choice, but if it is going to be helpful for somebody and they do want it, then we would hope that they would be offered it in a timely way. Again, if I link back to my own experience, I was put on HRT straight away as soon as I had a hysterectomy. I took it for years and then I ran out. And because I was sort of at menopause age, I thought, well, I'm gonna see what I do without it. I surely don't need it now. It's sort of 11 years or so after a hysterectomy. And I was probably okay for about a year. And then I suddenly realized I wasn't okay. It felt like I was wading through treacle, I had massive brain fog, total loss of confidence. And I went back to my GP and sort of explained that I'd sort of come off it, but, actually I needed to be back on it. And I was offered antidepressants, and I really had to fight to not have antidepressants because I'd needed antidepressants before, and I knew it wasn't depression. So eventually I got back onto a good HRT regime, but not without a bit of a fight, I have to say. So let's think about just some of those common menopause treatments. I don't think any of this will be new to anybody. And as I say, I'm not a medical profession, but these are pretty common. So obviously HRT, it's not for everyone, but it is an option. The NICE guidelines have recently introduced CBT, cognitive behavioral therapy, a talking therapy, as an option for menopause treatment, complementary therapies, alternative therapies, and then those good sort of lifestyle choices around healthy diet, balanced diet, getting enough exercise, trying to sleep well, trying to find some time to relax, and then minimizing some of those stimulants like caffeine and alcohol and tobacco as well. Okay, Jo, I think we're ready for our first poll, if I may. So we've got a couple polls during the session. This first poll is really asking is really asking just about the support that you offer in your organisation around menstrual health and menopause.
Just bear with me. That's not allowing me to launch it.
I'm just catching up on some of the comments on the messages. Yes, Kirsty, yeah, PCOS does also impact reproduction. It's hard to keep up with all the comments as well. So yeah, so forgive me if I miss any. And I think the
Bear with
list
me.
is many and varied.
Right, can you see
Thank
that?
you. Yes, thanks, Joe. So really, what we're asking here just is about your organisation and the support that you provide, if any. And please be honest, it's just to get an idea, because I think we're as businesses, more and more businesses are getting on board, talking about menopause, having a menopause policy. But I think in terms of menstrual health, we've still got a way to go.
Do you want me to end that, Ali?
Yeah,
We're sort of
if you're
edging
ready.
around. Yeah.
Yeah.
Okay. Can you see the results?
Yes, thank you. Yes, so we've got support for menstrual health only is around 3%, support for menopause only 35%, support for both 23%, and doesn't provide any support 38%. So still a way to go. Thanks, Joe. Thank you. So we can close that now. Great. Okay, sorry. Let me just move my slide on. Okay, so I've got some numbers here that I'm going to share with you, and I'd like you to just have a think about what you think this number might relate to in terms of the menopause, and we're talking menopause specifically here. So the first number is 50. Anyone got any thoughts about what this number might relate to? If you're happy to drop it in the chat, then please do. Age, yeah, you're absolutely right with age. So 50 to 64 is the fastest growing demographic in the workforce. So those experiencing menopausal symptoms can be forced to take a long-term absence for an average of 32 weeks during their career. Okay, so 50 to 64 is the fastest growing demographic in the workplace. So 51. Any ideas what 51 is? Keris, I don't know if you've just responded to that, but actually you're correct. So 51 is the average age at which a woman starts to experience menopause. Okay, next number, 67. Any thoughts what that number might be about? Yeah, state retirement age. Yeah, thank you. Again, Keris, you're on the ball here. And then 80. Any thoughts about what that number might relate to? Yeah, it's not it's not an age one actually. So I'll tell you, it's almost 80% of menopausal women are in employment, and about 25% of people going through menopause consider leaving their jobs because they find it difficult to deal with their symptoms, and that many of them, in fact, follow through and leave their jobs or reduce their working hours. So again, you've got some loss of key skills and talent there. So I think as the numbers we've already seen can demonstrate, there's a clear business case here for supporting menstruation and menopause. Just a little side note, employment tribunal claims are growing significantly in terms of menopause. We are talking from very, very low numbers, but since 2019, they've increased 300%. We were starting from a very low baseline of only 5 cases in 2017, but nonetheless, I guess what that is showing is an upward trend of menopause being cited as a reason for claims in tribunals. So let's think about the impact then on the workplace. So more than 2/3 of women in the UK have had bad experiences at work because of their periods. And in a survey of more than 2,000 women by the CIPD, 69% said that they'd had a negative experience at work because of their menstruation symptoms. More than half said that they had to miss work because of their period symptoms. Although 49% never tell their manager that their sick leave is related to their menstruation, perhaps not unsurprisingly. And 3/5 said that they have worked when they didn't feel well enough to. So again, contributing to presenteeism. And according to the CIPD, 1/3 of menopausal women have taken sick leave because of their symptoms, with only 1/4 feeling able to tell their manager why. An estimated 14 million working days are lost each year to menopause, equating to 1.88 billion in lost productivity. So unless organisations are providing the right support for people who have issues with their menstrual health or who are transitioning through the menopause, then we're going to lose experienced individuals and face significant costs in terms of recruiting and training, replacement, and the sort of current hiring costs are around 25,000 per worker. And of course, that's probably going to be a bit of a conservative estimate depending on the individual's role. So again, more reasons for us to be taking this very seriously and for us to consider it as a whole organisation approach. So I know a number of you said that you already have policies in place, which is great, or you've got some support in place. It's not law to have a policy, but many organisations do find them useful. But I don't know about your organisation. Having worked in HR, often policies can sit on a shelf and they're there to refer to, but actually not everybody knows about them. Not everybody sort of can read them and sort of work out how that relates to them. So having a policy can be helpful. Whether you have separate policies around menstrual health and menopause, or whether you have one combined, is completely down to the organisation. But what you should be also doing is thinking about how can you integrate some of the key messages around how you support menstrual health and menopause into your other key policies as well, such as equality and diversity, health and safety, and discipline, grievance, dismissal, absence management, etc. So if you are going to have a policy, then it's useful to outline what the aims and the scopes of the policy are, include definitions and key terms, such as, what are the key terms around menopause and menstrual health, and ensure that inclusive language is used. Responsibilities, outlining who in the organisation is responsible for what, and being clear about that. So making that clear on onboarding, induction, handbooks, etc. And include information about risk assessments and reasonable adjustments. And it should also include those tips for self-management, health and well-being, and sources of advice and support. In 2022, there was a poll, and 86% of respondents said they're more likely to work for a company that provided menstrual health, menopause, and pregnancy-related support. So again, another sort of reason why you perhaps want to be clear about your the offer and support that you have it sort of clearly laid out, whether that's in a policy or some other document. That can really help with your attraction and retention issues as well. And so as I said, it's all very well having a policy, but the Fawcett Society had a report around menopause in the workplace, and it showed that 8 out of 10 women say their employer hasn't shared information, trained staff, or put in place a menopause policy. So even if you've got a policy, have you shared it, and have you trained the relevant people to have inclusive conversations? Okay. So just, if that wasn't enough information for you, just to add to that, then there really is a strong business case for supporting those with their menstrual health and menopause. It's going to help to deal with any sort of sickness related absences, help you manage that effectively, increase motivation, improve employee loyalty, helps you to retain experienced employees. It's good for your organization's brand and reputation. It can play an important role in future-proofing for employers who want to attract and retain that diverse talent and have a supportive and inclusive culture, and to ensure that you're complying with relevant legislation as well. Okay, Jo, we've got our next poll, please.
Okay. Can you see that?
I can, yeah, thank you. Keris, you're absolutely right. It's the awareness and usage of the policy is so important. So many times they're just flat documents, aren't they, that don't mean much to anyone.
Big percentage is there. One big percentage. Okay, I'll end it.
Thanks, Jo.
Can you see the results now or not?
I can't, not yet.
Right, that's it.
Aha, here we go. So 82% saying nothing, 7% for both, menopause 12%, and nothing for people on menstrual health alone. Okay, really interesting. Thank you, everyone. Thanks, Jo. Okay, so let's think about how can we create that supportive menstruation and menopause culture at work. So some things that you can do. It's around building an open and inclusive culture. And that really starts with normalizing menstruation and menopause in the workplace through discussions and an open dialogue. It's about work-life inclusion, allowing people to bring their whole self to work, and people only will be able to do that if they feel that they will be accepted, if they've got that psychological safety in the workplace. So perhaps for those working in HR as leaders, it's also about role modeling those behaviors yourself, being open and transparent about your own lives and showing some vulnerability. Okay, it's about creating awareness and tackling stigma. So, usual things here around perhaps sort of wellness days, awareness days, making it part of your sort of well-being strategy. And if you have wellness blogs, if you have a section on your intranet or any comms avenues, it's about starting to include those topics so that people know that it's okay to talk about it, and also you're sort of able to signpost them to resources. You can do things like there are workplace pledges that you can sign to say that you're working towards being a menopause friendly employer, for example. Organizations like Henpecked have those pledges that organizations can sign. It's about developing a support framework. So that might include your policy and the support pathways, what you will do to support people. It might include things like coaching or training, and it's important to keep those support frameworks under review. And really importantly, it's about training and supporting people managers. And, I think we've gone a long way towards training people managers around having conversations around mental health. And I think we are a good few years behind when we're talking about conversations about menopause, and even further behind around menstruation. If I just think about my own situation in my sort of mid 30s, when I was probably at my most unwell with endometriosis, and it was difficult. I had a male boss. I didn't particularly want to talk to him about it. He didn't particularly want to listen. We got by, and I have to say, he was very supportive, but it wasn't easy. So if people have the training, if they understand the inclusive language that they can use, if they, recognize perhaps the stigma that goes along with the difficulty of these conversations, then it can make it easier for people to have those conversations. And this is certainly some training that we provide at the Thrive team. So just some tips really to take away around having those supportive conversations. Firstly, it's about not making assumptions. If your menstrual health is different to other people, if your menopause journey is different to somebody else, it can be easy to make assumptions, and we need to try to avoid that. Allow colleagues to decide how much information they want to share. Let them lead the conversation. Give options. That might be around options about who they might feel comfortable speaking to. If it's not their line manager, is there somebody else in the organisation that they would feel comfortable speaking to? Perhaps you have support groups in your organisation, or you're able to set them up where people can sort of talk freely. Menopause cafes, women's wellbeing groups, those sorts of things can be really helpful. It's about offering support and not medical advice. It's obviously recognising limits, but perhaps offering practical support, maybe thinking about reasonable adjustments or any adjustments that could be made in the workplace. It's about listening non-judgmentally and showing empathy, and we can show empathy by that non-judgmental listening. And of course, it's about being patient as well. Everybody's journey will be different. Everybody's willingness to share will be different as well. It's about getting your head behind what's appropriate language. And there are a couple of, in fact, I can, Joe, what I might do is I'll send you in, I'll add a couple of bits of information to the information that I know that you're going to send out. So bear with me on that. So there are a couple of places I can pinpoint you that gives you some good information around language for menopause, and also in talking about periods. So signpost to any trusted resources that might be inside or outside of your organisation. And it's also about respecting privacy and confidentiality. So just to finish then, if you're interested in this, you want to find out about more for yourself, for your organization, there are loads of places that you can find. I think almost everywhere you look at the moment is there's information about the menopause, but CIPD is a really good starting point. They've got some really excellent guides around both menstruation and menopause in the workplace. The BSI, the British Standards Institute, have a document called BS 30416, which is menstruation, menstrual health and menopause in the workplace, a guide, and they've also got a condensed version of it. So highly recommend you having a look at that if you haven't already. ACAS as well have got some information around menopause. Then you've got some of those perhaps more medical sources around the NHS, the British Menopause Society, and Dr. Louise Newson, who is a doctor, a menopause doctor, has a company called Newson Health, and at the Thrive team, we can help with coaching for individuals and also training managers on awareness. There are many, many more organisations I could tell you about as well. Wouldn't be able to fit them all in, and I can't recommend them all personally either. So, if anybody is interested and wants a bit more information, I'm happy to share that after the session. So I think I know Joe's going to send out some information about how you can connect with me if you want to, but just a final slide there. But I'm going to stop sharing now. And
a few little bits in the chat box, Ali.
Thank you. Let me have a quick look. Sorry, I can't. Not able to catch up with it all.
I think Kirsty's put one about any tips for brain fog. Keris has responded, but I don't know whether you've got anything else to add to that, Ali.
Yeah, so I think for me, the brain fog, is massive, and or it was massive for me, and it can be really, really frightening because I always used to have a phenomenal memory, and suddenly I just couldn't remember anything. I think just off the top of my head, I would say, try not to worry about it. I'd also say probably get good at writing notes, even if you haven't had to do that in the past. And also, I'd say take your time. I think we can feel under pressure when we're at work. I frequently have times when I can't remember or I don't know what word's going to come out of my mouth, and that can feel really sort of embarrassing. I've learned not to worry about it now, but that all takes time and getting used to. There'll be lots of sort of perhaps alternative therapies you could think about. I don't know, maybe things like aromatherapy oils, relaxation. But also, again, I'd say if you're worried about it, then maybe see your GP. Okay.
There's a couple of comments at the bottom, Ali. So Wendy's asked, has anyone any experience of the best way of documenting agreed adjustments? And then she specifically said menopause passports and disability passports.
Right. Yes, so I don't have any experience of either of those, but another very similar document might be if you're familiar with wellness recovery action plans, you can create a menopause action plan or a menstrual health action plan. I do have a template for that, so again, I can send that out. So I mean, quite simply, that is whatever the adjustments you are agreeing, you would just record that in normal way. If you choose to record that in notes, or if you choose to record that in another document, that's fine. But I guess what it is that you're both parties, have the same understanding of what's being agreed, and it's clear that, if you go back to look at it in a couple of months' time, it's going to be it's clear what you've agreed and for how long.
Yeah, there's some really good comments there, and there's quite a lot of the participants have been giving some good suggestions, so I think that's worked really well.
Great, thank you. So that's
Has anyone got anything else that they want to ask before we finish? Okay, I'll do the close. So thanks very much to everyone for signing up today. I hope you've enjoyed it. There was loads and loads of information there. So massive thanks to Ali for putting everything together. We'll send out an email to everyone that's signed up for the event, and I'll put a post on LinkedIn. So if you would like a copy of the slides or recording, then please put a comment against the LinkedIn post. If for whatever reason I don't send them to you, as someone has alluded to, then just send me an email. Sometimes if comments get put in later on, I'm not always notified of them. Our next event is on Tuesday, the 18th of June, and is called Stress and Anxiety in the Workplace, The Gathering Storm. A link for this will also be attached in the email. If anyone is recruiting, we've got accountancy recruit, FD recruit, and exec recruit. Otherwise, I'd just like to say a massive thanks to Ali for your time and effort in putting the event together, and also thanks to everybody for turning up. I'm sure you agree that it's been a good session. Thank you.